An injury or illness at sea requires coordination and immediate response time. Ship owners and managers need a healthcare program to handle primary health issues and medical emergencies quickly and effectively as these arise. FutureCare is a worldwide virtual healthcare company that specializes in medical care of seafarers at sea and landside for international blue water vessels. The company is a pioneer in managed healthcare services for the maritime industry through its 24/7 global first response team and international network of medical providers in all major ports of call. Assistance is rendered by FutureCare's team of physicians trained to provide remote medical advice to captains and their crew. This is the main function of FutureCare's Caring for the Crew program, developed to deliver quality health care services to seafarers internationally. Christina DeSimone founded FutureCare in 1996. Since then, her international team has developed an efficient and cooperative global network of medical facilities to assure quality care for its members. From its inception, FutureCare remains dedicated to ensuring the health and well-being of its seafarers as they travel the world.
FutureCare has accomplished so much in the last few years. We started out being medical care managers for the seafarer, being assigned by the maritime P&I clubs, the P&I club correspondents, ship owners asking for our help, but only when the crew member was already admitted to a hospital. The process that we learned from these assignments that was missing was how do you provide good primary medical treatment at sea and begin to treat the seafarer before he reaches a port of call.
Dr. Brian Bourgeois is FutureCare's lead physician on their 24-hour medical advice helpline. His training is in surgery, emergency medicine, and advanced trauma life support. All of FutureCare's global network for physicians are specially trained and experienced in the care of maritime employees.
I think one of the unique aspects of FutureCare is the simple fact that we are there when they need us. The crew, being a person who's out maybe possibly in the middle of the Atlantic Ocean, obviously does not have a normal access to health care. But if the crew understands that there's somebody within a short phone call away who even can directly speak to them on the phone, I think that gives them a fair level of comfort. The typical individual that we communicate directly with is the captain. They have a relatively high level of education. The captain has the medication list. He understands what is stocked on the vessel and knows how to administer it.
By having trained medical physicians on call, a medical problem that may present itself and can seem rather extreme can be correctly diagnosed and treated right there on board. This prevents unnecessary treatment and prevents unnecessary deviation of the vessel or a potential evacuation. FutureCare's system of medical assistance at sea applies to all ships that do not have a doctor on board. Although professional seafarers are the principal beneficiaries of the program, passengers on ships as well as pleasure craft would also benefit.
What sets FutureCare apart from other medical maritime businesses is we have a system of taking care of the crew member from onset of injury or illness and through his recovery process once he's repatriated home. We take care of the crew member until he is at maximum medical improvement.
To ensure that, an expert triage team consisting of physicians, first responders, and nurse case managers work together and confirm a plan of action, which will optimize care and contain cost. Every medical case is closely monitored with regular medical documentation and case tracking. This network, the product of years of experience and training within the maritime environment, helps to assure that every seafarer, no matter where in the world he is, can count on the best medical standard treatments available when he needs it the most.
Many times these crew members are feeling poorly or feeling ill. They have a lot of questions. They're not able to access a normal standard healthcare department, and we are right there at that time when they need us, able to be on the phone with them, through an email with them, help translate languages.
The FutureCare program ensures that the captain of a vessel is not alone while being responsible for the health of their crew members and their safety aboard. The paradigm change is the evolvement from evacuation-oriented emergency advice services at sea to the full prescription of treatment for both on-ship and shore-based medical arrangements. We are there to always assist the captain and his operations team with appropriate medical decisions. Of course, an evacuation and vessel deviation are sometimes necessary, but by nature, they are dangerous and expensive, and they are best avoided when possible.
I am very proud of Future Care and our international network of medical providers. It is our newest and most exciting time for Future Care because it requires really a global cooperative network of medical facilities in order to take care of the seafarer.
If treatment or hospitalization ashore in any port of call are deemed necessary, Future Care's team pre-certifies the medical facility and assigns a physician or nurse case manager. This medical care manager will counsel and support the ill or injured crew member throughout treatment, and will also supervise and monitor the medical treatments on a daily basis. All expenses and treatments are monitored in real time to ensure that care and costs are up to standards for the specific geographic region.
When we started Future Care, we started with a group of very experienced nurses and doctors and care managers, and our primary interest has always been the feeling that we're doing something to really help the seafarer and to improve his chances of remaining healthy and staying healthy on board a vessel with a rigorous work routine. So it really makes us feel so content to provide that service and just so proud.
Medical care programs for seafarers while at work will be required by the Maritime Labor Convention 2006 mandate Title IV by 2013. The overall objective of Title IV is to provide a system of medical assistance at sea and landside as soon as possible, equivalent to healthcare services provided to land-based employees. Future Care's global services are in full compliance with these new healthcare regulations. Future Care has built its success by bringing together the best and brightest healthcare professionals, continuous innovation, and a world team of care managers dedicated to the unique maritime environment. Future Care is monitoring and managing seafarers' health while working and living on board commercial vessels and keeping the seafarer healthy and secure in the knowledge that they are being well taken care of.